Morning, I'm Dr. T, first year master student in UKM. So I've been given the task in my PD assessment to record a 3-minute video in which the scenario given is you on your morning rounds. When you notice your colleague, which a junior doctor, behave unusually with inappropriate conversations and impaired coordination with the smell of alcohol in their breath, and he or she is actively reviewing the patients and writing orders in the patient's file. So first of all, the first question is, how do you handle the situation in accordance to medical code of professional conduct? So there are a few codes of medical professional conduct. For example, the first code of conduct is the doctors must make sure the care of the safety of the patients as their first concern. So I would ensure that the colleagues have been stopped seeing the patients and writing orders for the patients, and should have double checked that their clinical decision that have already made is correct to prevent any potential harm to the patients. Second, the code of conduct requires that unsafe and also impaired practice need to be reported to the superior to protect the patients, and do not speculate or accuse your colleagues unnecessarily. And also the conducts require that your colleague to be treated with respect and protect their confidentiality. So do not discuss the incidents to others, staff, except your superiors that occur, and should have support your colleagues which may be unwell, or to know that what is going on with your colleague. And the second question is, how will you balance your duty to protect the profession safety and maintain professional integrity and to support your colleague? So first, I would like to prioritize the patient safety first, and I will find a way to remove my colleague from any clinical duties immediately, but sensitively. Like for example, I will tell the junior colleagues that I would like to speak to them privately for moments, and suggest them to take a break and to prevent actively reviewing the patients and prevent further harm to the patients. And do not let your colleagues to continue reviewing patients and writing orders. And secondly, I will inform to my superior, who is the specialist or any work consultant or registrar on call that day, regarding that incident that have already occurred. And also I will document all the incidents objectively, and to record what I have already observed without any judgment. And the documentation regarding your colleague should be private and also confidential. And I will support my colleagues professionally to avoid any confrontation. Make sure to avoid any confrontation or blaming at that moment. I will ensure that the safety of the colleague is preserved and encourage them to seek any support, for example, any support group or any occupational safety, to seek advice from them or from the superior also. And I will follow up with my superior and with my senior to ensure that my colleague had get proper support appropriately, and proper action has to be taken. And thirdly is likely the steps that I would do immediately, and how do I approach this issue as long term. So I have mentioned just now the steps that I will take immediately include, I will prioritize my patient safety first. Next, I will remove my colleague from doing the clinical duties, inform the superior, and document what has already happened. And all the documentation should be kept private and confidential, and do not expose to the others working staff except your superior. So I will make sure also the appropriate actions that has been taken. And for long-term approach, I will support my colleague to referring my colleague to any support group, and make sure that we recognize the impairment that have already occurred. Maybe for example, my colleague is under stress or burnt out or having any addiction or any mental health illness. So I will support them with compassion and try to liaise with my colleagues to make sure all the timetable should be evenly covered. Then I'll have to support my colleague also. So I will support them with the compassion and make sure that proper reporting has already been done. For example, like any proper documentation, hospital incident reporting system, and if necessary, we can report to the medical board if in line with the duty and to protect the public health. And also finally, I would like to reflect, debrief, and also ensure that my own well-being is being supported. And we've been a team to reflect how to create a safe space or supportive culture that can identify or address this kind of impairment earlier, and also understand the institutional and also the ethical guidelines. The fourth, which the final question, is what ethical principle guides my actions, and what are the challenges that might arise in addressing this kind of sensitive issues. So the ethics principles that has been implied in this scenario is first, beneficence, which we act in the best interest for the patients, and we should ensure the patient receive a safe and appropriate care. Second is non-maleficence, which we do not harm the patients, and to prevent any unsafe care by removing my impaired colleagues to continue his or her clinical task. And third is respect for persons, where I will be respect others person's dignity and compassion. For example, I will respect my colleague's dignity by acting to not expose the incident to other staff except to the superior. And fourth is the justice. So I will give the fair treatment and accountability, which ensure is a safe and also fair care to the patients and my colleagues. By balancing the accountability with patients and access support group to my colleague, and finally professional integrity, where I act with honest and also integrity for mine and myself. And also the challenges that I address when attending this sensitive issue is first the emotional discomfort, where first I have to stay professional and act calmly and with empathy, and sometimes it is very uncomfortable, where I will confront my colleagues, who is especially my best friend or peer, that might worry about damaging our relationships with them and can be perceived as a disloyal or maybe a backslap to my colleagues. Second is the fear of harm to my colleagues, which all the reporting cases can lead to a disciplinary action to his or her career and impact their career. So the concern is that they might be struggling from, example, burnout, any mental illness or any stress, substance use disorder that might need help rather than a punishment. And finally, the challenges is that it can risk my own self, which I might be involved in a formal investigation, and I will be worried about that I labeled as a troublemaker or dealing a backlash to my team member by reporting this kind of sensitive issue. But we are helping first for the patients as well as our colleagues, and make sure for the public service, the main priority is to make sure the patients' health and safety come first. That's all. Thank you.